Hi, this is Dr. Tom Rogers at Performance Medicine, taking you on a journey of better health, hopefully, if you listen to what I say and maybe act and figure out for yourself what's best for you. But all I can do is give you, hopefully, experienced, researched opinions on what I do and what I would do if you were my patient. Today, I want to talk about low-dose aspirin. This thing that I've been recommending for many, many years, and that I've been taking for many years. I'm 66. I started taking low-dose aspirin at age 40, and I'm kind of glad I have. And it's an 81 milligram coated aspirin is what I take. We all know that a daily aspirin will go a long ways to preventing heart disease. It really acts because it prevents blood clots. It basically makes your blood a little slippier, less likely to clot. As you know, when you have a heart attack or stroke, usually it's because you formed a blood clot that then can block off the artery or cause an arrhythmia. So I'm definitely a big proponent of taking a baby aspirin for years. Now, the use of aspirin kind of gets popular, then some study will come out and say, well, it may not be as effective as originally thought, but the point is it's a very safe way to prevent cardiac deaths. And, cardiac deaths is, of course, the number one leading cause of death in the world, especially the U.S. But the reason I'm going to talk about low-dose aspirin today is because of a second thing that I've been talking about also for years that a lot of people still don't realize, but it's well established now that low-dose aspirin is effective at preventing colon cancer. Colon cancer, if you combine men and women, is the second leading cause of cancer death in America. So it's fairly common. I think a little bit over 50,000 Americans a year die of colon cancer. And it's really a horrible death. I've seen it happen. It gets metastasized. It's a hard way to go. That's another reason why I really want you to get a colonoscopy at age 50 as a routine screen. Then if you're clear with no polyps and no family history, once every 10 years is probably good enough. And you need to get the colonoscopy sooner if you have symptoms like rectal bleeding or change in bowel habits, or you have a family history of colon cancer. And generally, say your father had colon cancer at age 50, then you should get your first colonoscopy at age 35, 15 years before that first-degree relative was diagnosed with colon cancer. Because in general, it's a pretty slow-growing cancer. That's why, to me, it's one of the most preventable cancers there is. It usually starts out with a benign polyp that on colonoscopy they can just snip off and get the pathology and tell you what your risks are. So it's very slow-growing. Get your colonoscopy at age 50. I've scheduled 2 today, I think, on some of my patients. But the reason I want to talk about low-dose aspirin for colon cancer prevention, is because there's a lot of new evidence that it's pretty established that it does cause prevention of colon cancer. But the thing that they found out is it depends on when you start taking the low-dose aspirin. So you don't want to wait until you're 70 years old to start taking low-dose aspirin. You really want to start it in your 50s and 60s for the prevention of colon cancer. Now, of course, I recommend you start it at age 40 for both heart protection and colon cancer prevention, unless you have something like an ulcer or something. Now, the reason they say that you may want to think about it if you're older than 70 for cardiac prevention is because of that chance if you fell and hit your head and had a brain bleed, it'd be more likely with a low-dose aspirin that you would bleed, which is true. So it depends on what kind of shape you're in at 70 and 80. I mean, if you're in great shape, you're lean, you're exercising, I would definitely still take the low-dose aspirin for prevention of heart disease. And the same thing in these new studies with colon cancer prevention have borne out. It's much better if you start early taking this aspirin. But if you're 70 years old and even diagnosed with colon cancer, you should still keep taking it, because the chance of metastasis and you doing bad with colon cancer is going to be much better if you're on that aspirin. So the word here is, unless you have an ulcer or a bleeding tendency, you should, on average, take a low-dose 81 milligram enteric-coated aspirin starting about age 40, and then just continue it. Now, if you get pretty frail and your elderly mom is falling all over the place, get them off the aspirin, because the risk may be greater than the prevention. But certainly, this is big and great news for colon cancer prevention. Just another great reason to take a simple, cheap 81 milligram aspirin for the rest of your life, or at least until you get too frail and the dangers of you falling are greater than the risk of taking a baby aspirin every day. So think about that. Put it in your daily armamentarium with your vitamins that we recommend. And if you have any questions or hesitancies, just please contact us at the office. I hope you have a great week. We'll talk next week.